Somewhere in the dense, conflict-ridden forests of northeastern Democratic Republic of Congo, in a place called Ituri Province, people began falling sick. Fever, body pain, weakness, and then bleeding. Within days, dozens were dead. What started as a cluster of unexplained deaths in remote mining communities has now crossed international borders. As of May 19, 2026, the world is watching as Ebola, one of the most feared viruses known to humanity, has struck again. This is not a drill. This is real. And the CDC has just issued an emergency health alert. Stay with us, because what you're about to learn could save your life. The Democratic Republic of Congo, or DRC, is a vast, resource-rich nation in Central Africa. Its northeastern corner, Ituri Province, is a region known for gold mining, dense rainforest, and unfortunately, decades of conflict and instability. It is here that this new Ebola outbreak began. On May 15, 2026, the DRC Ministry of Health officially confirmed the outbreak. Health investigators identified two specific areas at the center of the crisis: the Mongwalu and Ruampara health zones, where clusters of severe illness and death had already been occurring. By May 16, just one day later, the numbers were already alarming: 246 suspected cases and 80 deaths reported. That is a staggering toll in just the early days of a confirmed outbreak. And then, the nightmare spread. In neighboring Uganda, health authorities confirmed a case of Ebola in a patient who had traveled across the border from the DRC. That patient later died while receiving care. Uganda immediately activated emergency surveillance, screening, and response measures. But the virus had already crossed the line now. Let's talk science. Not all Ebola outbreaks are caused by the same virus. What makes this 2026 outbreak particularly significant is the specific type of Ebola virus responsible. Ebola disease is caused by a group of viruses called orthobolaviruses. There are 4 species that infect humans: Ebolavirus, the most deadly, also called the Zaire strain Sudan virus Tai forest virus, and the one responsible for this outbreak. Bundibugyo virus. The Bundibugyo virus was first discovered in Uganda in 2007, in a district that shares its name. This species has historically caused lower death rates than the Zaire strain, but make no mistake, it is still deeply dangerous. Previous Bundibugyo outbreaks have had mortality rates between 25% and 50%. In plain language, up to half of infected people died. Without early treatment and intensive care, Ebola kills mercilessly. Picture: illustration of Ebola incubation timeline, 2 days to 21 days the incubation period. The time between exposure and symptoms ranges from 2 to 21 days. This is critical because infected people may feel completely fine while unknowingly spreading the virus. One of the most important things to understand about Ebola is how it spreads, and how it doesn't. Ebola is not airborne. You cannot catch it by breathing the same air as an infected person. This is a crucial distinction that separates it from diseases like COVID-19 or influenza. Ebola spreads through direct contact, when broken skin or mucous membranes come into contact with the bodily fluids of a sick or deceased person. This includes blood, urine, feces, saliva, semen, and other secretions. Tragically, traditional funeral practices, where families and community members wash or touch the bodies of the deceased, have historically been a major driver of Ebola transmission. An infected corpse remains highly contagious. Ebola can also jump from animals to humans. Bats, forest antelopes, and non-human primates like chimpanzees and gorillas are known reservoirs. Visiting caves, handling bushmeat, or entering bat-inhabited areas significantly raises the risk. In healthcare settings, contaminated needles and medical equipment have been responsible for rapid spread, especially in under-resourced hospitals. Recognizing Ebola symptoms early can literally be the difference between life and death, for the patient and for everyone around them. Ebola disease progresses in 2 broad phases, sometimes called the dry phase and the wet phase. In the early dry phase, symptoms look deceptively like common illnesses: fever, severe headache, muscle and joint pain, fatigue, and loss of appetite. At this stage, a patient is not yet considered highly contagious, but the virus is already multiplying rapidly inside the body. Within days, the disease escalates into the wet phase, characterized by severe diarrhea, vomiting, abdominal pain, and in some cases, unexplained bleeding from multiple sites. Patients deteriorate rapidly. Several patients in this DRC outbreak reportedly deteriorated and died within a very short time after symptoms appeared. Without immediate isolation, intensive supportive care, and IV fluids, outcomes are grim. This outbreak has not gone unnoticed at the highest levels of global health governance. On May 17, 2026, just 2 days after DRC's official confirmation, the World Health Organization declared this outbreak a public health emergency of international concern, or PHEIC. This is the WHO's highest level of global alert, the same designation that was used for COVID-19. The CDC has issued a Level 3 travel health notice for the Democratic Republic of Congo, advising Americans to avoid non-essential travel to Ituri and Nord-Kivu provinces. For Uganda, a Level 1 notice has been issued, recommending that travelers practice enhanced precautions. The CDC is already on the ground, working through country offices in DRC and Uganda to assist with contact tracing, laboratory testing, virus sequencing, and infection prevention efforts. International coordination is in full swing. And here's sobering context. This is the 17th recorded Ebola outbreak in the DRC since the virus was first identified in 1976. The previous DRC outbreak ended as recently as December 2025, just 5 months ago. Here is perhaps the most alarming aspect of this particular outbreak. There is currently no FDA-licensed or authorized vaccine to protect against Bundibugyo virus. The Ebola vaccine that exists in the United States, known as ERV-EBO, was designed specifically for the Zaire strain of Ebola. Based on animal studies, it is not expected to protect against Bundibugyo virus. There are also no FDA-approved treatments for Bundibugyo virus disease. Some therapies have shown promise in animal models, and intensive supportive care, particularly aggressive fluid replacement, can improve survival odds. But the bottom line is that right now, the best protection is prevention. So what does all of this mean for you? Let's break it down by who you are and where you are. If you are a traveler, the CDC strongly advises avoiding non-essential travel to Ituri and Nord-Kivu provinces in DRC. If you must travel to DRC or Uganda, avoid contact with sick individuals, do not attend funerals or handle bodies. Stay away from healthcare facilities unless it is an emergency, and avoid contact with wildlife, especially bats and primates. If you are a healthcare worker, if a patient presents with fever, muscle pain, unexplained bleeding, and has traveled to DRC or Uganda within the past 21 days, Ebola must be on your differential diagnosis. Immediately isolate the patient, don full PPE, and contact your state or local health department. Do not wait. If you have recently returned from DRC or Uganda, monitor yourself every day for 21 days after leaving. If you develop any symptoms, fever, aches, fatigue, gastrointestinal issues, self-isolate immediately, do not travel, and contact local health authorities before entering any medical facility. Alert healthcare providers of your travel history. The CDC Emergency Operations Center is available 24 hours a day, 7 days a week at 774-887100 for consultations about this outbreak. Why does Ebola keep returning to the DRC? This is a question that goes beyond virology into politics, poverty, and human suffering. The Ituri Province, where this outbreak began, is plagued by ongoing armed conflict, widespread population displacement, and heavy mining activity that brings thousands of migrant workers into contact with forest wildlife. These are precisely the conditions under which Ebola thrives and spreads. Frequent cross-border travel between DRC and Uganda means that once an outbreak starts, it does not stay contained. The case confirmed in Uganda is proof of that. The DRC has now experienced 17 Ebola outbreaks since 1976, more than any other country in the world. The virus has become almost cyclical, emerging, causing devastation, being contained, and then returning. Each time, communities are left scarred and the global health system is tested. The global health community's response, contact tracing, laboratory testing, community education, border screening, is more sophisticated now than it was decades ago. But until the underlying conditions of conflict, poverty, and weak health infrastructure are addressed, Ebola will keep finding its way back. The good news, and there is good news, is that the CDC currently assesses the risk of this outbreak spreading to the United States as low. As of May 18, 2026, there have been no suspected, probable, or confirmed cases of this Ebola strain in the United States. But low risk does not mean no risk. In a globally connected world, a virus in Ituri Province today can arrive at an international airport tomorrow. Awareness, preparation, and a strong public health response are the shields that protect all of us. Our hearts go out to the people of Ituri Province in Uganda, to the families who have lost loved ones, and to the health workers bravely working on the front lines in some of the most challenging conditions imaginable. Stay informed. Stay prepared. And if you or anyone you know has been to affected areas and developed symptoms, act fast. In the fight against Ebola, speed is everything. If you found this video informative, please share it. This is the kind of information that can genuinely save lives. Subscribe for ongoing updates as this outbreak evolves. The situation is being monitored daily, and we will keep you posted.